you ever wonder what part of the body is most sensitive to pain? Well, guess what? It's in the eye. Hi everyone, today we're going to talk about the human cornea. My name is Josh Cohen. I'm a board-certified ophthalmologist at Cohen Laser Vision Center in Boca Raton, Florida, and I specialize in refractive surgery, which deals a lot with this very important but kind of boring structure. So the cornea is the front window of the eye, and basically the purpose of the cornea is to protect the eye, obviously because it's the most anterior or front-facing part of the anatomy. When you're looking out and even looking at someone, you see it all the time, but don't really see it because it's transparent. However, under special instruments and slit lamps, we can see cross-sections through the cornea and get a lot of helpful information to evaluate what someone's problem may be. In order for the cornea to be healthy, it needs to basically have three components. Number one, it needs to be transparent. Number two, it needs to be curved correctly. And number three, it needs to be comfortable. In other words, it needs to be properly nourished, okay? So let's talk about each of those properties one by one. So the first issue has to deal with comfort. As I mentioned, there are more nerves per square millimeter in the cornea, sensory nerves, than practically anywhere else in the body. And that's why even the slightest breeze or dust particle or foreign body grain of sand can be really, really uncomfortable, if anyone who has had that happen to them can attest to. And the reason why people can feel discomfort or foreign body sensation or irritation in the eye is due to damage or disruption in the corneal epithelium. And the number one cause of that, as I mentioned in other videos, is dry eye disease, or any sort of ocular surface disruption in the tear film, or how the eyelid interacts with the cornea, or just how well the cornea can be lubricated. In all those situations, the corneal epithelium can dry out, can be desiccated, can even flake off in certain situations, and that is quite uncomfortable. And that can affect, obviously, your well-being overall day to day, but it can also affect your vision. So the corneal epithelial health is very, very important for your overall vision and comfort. Now, if you want to learn more about symptoms of dry eye disease and how to treat it, I have other videos in the playlist that I will list below. The second most important thing when it comes to the corneal health overall is the curvature or shape of the eye, and that has to do with the refractive power of the eye. When light comes through the eye, it passes first through the cornea, and then through the lens, and then through the clear vitreous cavity, and then all the way back to the retina or the macula, where the visual input is processed. And most of the bending or refracting power is in the cornea itself. If the cornea is too flat, that leads to a problem called hyperopia. If the cornea is too steep or curved, that leads to a problem called nearsightedness or myopia. And again, I have other videos about refractive error, which I will link here, and how we treat that with refractive surgery, of which there are many options today. But the overall curvature of the cornea is important for your vision, but not necessarily for the health of the eye. A cornea that's shaped irregularly, as long as it's normal in terms of its structure, really doesn't lead to any long-term problems, except for needing glasses or contacts. As I mentioned, the cornea needs to maintain its transparency. And if the transparency is altered, it's usually due to a problem in a few different aspects. One is the cornea can have some scar or some problem in how the corneal proteins or collagens are oriented, and there are many causes to that. Or the cornea can be too thick or too thin, and we'll talk about those in just a moment. So let's talk about more about corneal opacity primarily. If you have a scratch in the eye that doesn't heal properly or might get infected, that's called a corneal ulcer or infectious keratitis. Now, we treat that by a careful slit lamp exam, and we do special stains and dyes to look at where the problem might be within the corneal tissue. But if we determine that it is an infection, we often have to culture the eye, determine what type of bug we're dealing with, whether it's a virus or bacteria or fungus or something else. There's even little amoebas called the amoeba that can be really, really painful and really problematic if those get embedded within the corneal tissues. But all these are more or less treatable, but they all require different techniques, oftentimes topical or fortified eye drops with antibiotics in them, and just very frequent follow-up. In the worst case scenario, if we can't treat it entirely, or if we treat it but we leave some residual opacities that affect your vision, then sometimes transplants are required. Well, let's step back and look at the overall anatomy of the cornea. As I mentioned previously, the epithelium or the top layer is most important, and that regenerates constantly, basically every day. And that grows from the outside in through special stem cells called limbal stem cells that are responsible for repairing the tear film and making sure that it's thick enough and healthy enough. That's the top 10% of the cornea. The overall thickness of the cornea is about 0.5 millimeter thick, or about 1/50th of an inch or so. So just kind of keep that in mind. However, if the cornea is too thick, that's often due to a problem in the very back layer of cells called the endothelium. those cells don't regenerate, and those cells are responsible for basically pumping fluid out of the cornea to maintain the proper transparency. It's just like if you have a clear piece of glass. If you start stacking a bunch of glass on top of each other, even though each layer is clear, a lot of them on top will eventually compromise your vision through that structure. That's what happens when there's too much fluid within the cornea. The most common reason for corneal thickening is Fuch's dystrophy, which is an inherited corneal dystrophy that has to do with a regular function of those corneal endothelial cells. This often happens later in life because the cells naturally diminish with time and they kind of have to repopulate, and each cell kind of grows and expands to cover more surface area because, as I mentioned, the number doesn't change. Now, in advanced cases of Fuch's dystrophy where the corneal transparency is compromised and the corneal endothelial cells are unable to keep up, then we do a special transplant called an endothelial transplant, which requires peeling off the natural endothelial layer and replacing it either with a donor tissue that contains just endothelial cells, that's called DMEK, or with an area that includes some of the corneal stroma, which is the thick collagen within the major structure of the cornea, that's called a DSEK. And both of these are done by corneal specialists or surgeons able to do this particular surgery, and it is a very delicate procedure, but something that is sometimes necessary and can be very helpful for patients in that situation. You can also get corneal thickening from trauma or surgery, or from other inflammatory problems. All those things can be treated in different ways, sometimes medically with eye drops. There's a special drop called Muro, which contains some salt, which some studies suggest can kind of help the body kind of wick the natural fluid out. Now, on the other end of the spectrum, if the cornea is too thin, then that could be a problem too, particularly for patients considering refractive surgery, because sometimes with lasers, we remove tissue, we don't want to remove too much, where the corneal instability can become a problem. And that generally is called corneal ectasia. Now, the most common form of ectasia is keratoconus, again, an inherited form of corneal thinning that is progressive, often starts in your teens and 20s and continues throughout life, and can lead to what's called an irregular astigmatism, where the shape of the cornea becomes flatter on one side and steeper on another, where it can be difficult to correct that with glasses or contacts. Sometimes you need special contacts called scleral lenses or hybrid lenses to treat that, and I talk about that in some other videos as well. The keratoconus can also lead to thinning of the cornea to the point where there is a breakdown in the corneal endothelium, that's called corneal hydrops, where it scars down, where the corneal structure in general just doesn't function well at all, and that usually requires a transplant to treat. Now, we can treat keratoconus with a few different ways. Number one is we can do corneal crosslinking, which involves applying riboflavin or a special B vitamin, which is vitamin B2. That can be applied as a dropper onto the eye, and then eventually ultraviolet light, not a laser, but ultraviolet light can be used to stimulate the collagen proteins to cross-link with each other, so they form a more stable bond with one another to prevent them from sliding across and becoming unstable or too thin. We can also do special implants or inlays within the corneal tissue to flatten and steepen the area in precise ways to create a more symmetric curvature that can improve your vision. And as I mentioned, you can do special contacts as well, or in late stages, about 1 in 6 or 1 in 7 patients may need a corneal transplant, particularly in more severe cases. So that's an overview of the cornea. Again, the structure of the epithelium, the stroma, and the endothelium are all important to maintain the overall health of the cornea. And here at Corneal Intervention Center, we treat corneal disease in a variety of ways and can help you diagnose if the problem in your vision is due to the cornea or something else. So I hope that helps. If you have a corneal problem, please feel free to share your experience below. If you have any questions about this, again, comments and questions are welcome. Thank you again for your time, and I will see you in the next video.